doesn't drink beer.
That's fine.
Trying to get all kinds of
I got my mom. I got my mom.
Well, thanks for at least listening. Enjoy the rest
Thank you.
I was an only child.
I know.
I wanted to download the new app, but then it's like, oh,
I would say, yeah. 67. Yeah. San Francisco.
Yeah.
eat lunch with a group. Right. Yeah. Because I'm like, what would you like?
I'm sorry. Because I downloaded the
Yeah. I've always had it, like, if you travel stuff.
Phone works for some telemarketer, but it won't work for us. So frustrating.
Ship's noisy today.
Oh, I love it.
It's like when I wake up and stretch my back. Edit all the cracks and pops of the boat out.
So, but it's, yeah, so. So she's sort of. She comes. I mean, they have some. But she's young.
If we decide to have lunch from the Lido deck, where and when should?
1:30 back here. 1:30 to 3:30 is our time this afternoon. Back here.
She's not chilled.
Leslie, we have this room this afternoon, right?
Yes.
Okay, yes.
Now, if someone wants to do the beer tasting though at 1, we'll have to reconnect.
At the moment, I don't have any papers.
Okay, okay. I was gonna say it would be like 12:45.
It makes me happy. 1:30 to 3:30.
Yes.
So that means I can do that. I mean, I'll bring him back.
Let me check with Kathy, because it may be in that you may want to just pick them up in the dining room at tea.
They're gonna have-
Because they say 1:30 to 3:30 for respite. But if you're gonna be in the dining room for tea at 3, you won't be done by 3:30, so maybe just come to the dining room.
We're good. At 3? Tea at 3, I'm free.
So at 3:30, you can just come by the dining room.
Well, I thought we're going to eat.
And that's what we're gonna go to. Okay, for sure.
It might be easier to come up there because you guys do that. You know, but then others may still, you know, by the time we got back here, the opposite end of the ship, it might not be exactly 3:30.
Dining room on level 3.
Oh, maybe your child.
Yeah.
Do we know what night yet we're having the group dinner and the
We don't. I have the request in, I don't have a confirmation yet.
I totally understand what you're saying. Yeah. I don't want to be taken, I want to take myself.
You just need to stop being so organized. Just go with the flow.
Yes. Go with the flow, and if the flow don't go, right?
Okay. I actually follow that.
It's a very, very, very impactful model. So good morning, everyone, and thank you so much for your attention and enjoying Kathy's lovely chat about what we're doing here. I think it's very beautiful, and well, she keeps inviting me back, so I must be doing something right. So I want to invite you again to this talk, this session called Caregiving 101. And in this talk, we're going to talk about 3 very essential boundaries that we have as individuals. And then once we understand those boundaries, how do we then approach a person who might have different boundaries, or who might have a dementia or a physical impairment or a mental illness that's unseen that changes their boundaries, their perception of boundaries. Okay? So we'll be very gentle, very straightforward. This is going to be a little interactive, so make sure you have a person next to you for this topic. And if you have 2 or 3 next to you, that's okay too, but this is going to be a little hands-on in the second half of this conversation as I introduce the hand-in-hand technique. It's have you ever heard of Teepa Snow? Yeah, so I love Teepa Snow. She is a goddess. I can't wait till she's on our boat. And I had a number of good interactions where she showed me hand in hand and how do we do these things. And ever since I learned that, I can't go back. I can't go back because that is an essential technique that you got to have in your toolbox as things progress, as things go on. Sometimes they become more difficult. So we want to have every tool in our toolbox to make things a little bit easier on ourselves and our loved ones. So, okay. This is an older picture of me, and actually a little outdated slide. Go figure. 7 years professional. You can add 3 more to that. I've been a certified nursing aide for 10 years. I started in my college experience, and I was doing cooking, and I didn't like cooking. And I tried business, and I didn't like business. And I was kind of like, I don't know what to do with myself. And so I was like, okay, I'll just join nursing. That's what Mom did. She's a nurse. Why don't I do that? And then she's like, well, hold your roll, boy. The first thing you need to learn is what the people underneath the nurses do. What do the CNAs do? What do the home health aides do? What do the people who you are responsible for doing? And so I signed up for a CNA class. I took a 10-week class at a community college, and wow, that was it. That was it for me. I loved it. And I got to see what the nurses do, and I seen how many times they're popping those pill packs and passing pills, and I became aware of how infrequently they actually had quality hand-in-hand, hold-in-hand, intimate contact with the clients. It was a performance art, so to speak, for the nurses, where with us hands-on caregiver, there was a little bit more hands-on care, a little bit more gentleness. Yeah, we had a little bit more to do, a little bit rougher, getting our hands a little dirtier, but there was something about the intimacy and relationship that I began to cultivate with people that was it for me. So I was like, no, Mom, you're right. No, you were right. I'm glad I did this first. Because had I gotten into nursing, I'd been like, oh man, I don't enjoy this at all. So during that process, I became more and more and more invested into working with the senior communities I was working in. And I got involved with working in an Alzheimer's unit and dementia unit. And that was just mind-blowing. I had no idea how different it could be and is. Not only dementia versus someone who just has a mobility challenge, but then every single person has their own unique form of dementia that makes them just a little bit more special and a little bit more unique. So they have those gifts and those abilities that we want to channel and engage with. And so I became a certified dementia practitioner. Which it sounds like I just practiced dementia, but what that indicates is that I've taken the time and I'm choosing to dedicate my experience to learning about what this dementia process is and how do we support people in it. I also became a consultant, Ageless Grace. So Kathy was introducing this. So when she was moving her fingers in the air and we were drawing cat and dog with our elbows. So that's one of the activities that we discover in Ageless Grace, which is a form of mind-body movement engagement activity. Became a caregiving educator, caregiving consultant, and I'm no longer a master's candidate. I have my master's, a little outdated here, but I have my master's from Naropa University in Colorado, where, as I mentioned, I specialize in mindfulness-based transpersonal counseling.
What is that, please?
What is that, please?
Thank
Absolutely,
you.
absolutely. So let's break it down. We'll break it down word by word. So the first word is mindfulness. So this is that a little Zen, but it's bigger than that. It's a way of being. It's a way of living. It's like what Kathy was talking about with neuroplasticity. It's choosing to taste something different, to smell something different, to take your shoes off and make contact with what's here. It's choosing to recognize what's inside of your heart and your spirit. And when I was a caregiver, I was stressed. And I had no idea how to take care of myself. And at some point, I discovered a mindfulness course. I took that, and it was it. It was it for me. I was like, I want to bring mindfulness to caregivers. For me, it changed the way I related to myself, and it improved the quality of relationship I had with my clients. So mindfulness is a bigger philosophy. It's a way of being with. It's intentional. It's choosing to be present with people. There's a sense of choice, right? And that's the biggest, most encouraging thing is choice. So when you see mindfulness, choice. So transpersonal, this is so if you go to most Western schools, higher education universities, and you take a psychology class, I had a Bachelor of Arts in Psychology, and not one of my classes through the entirety of my undergraduate career talked about spirituality and how spirituality and psychology interact. And so when you see the word transpersonal, think of like transcontinental railroad, across, beyond, what extends. So transpersonal are those things and those elements of our lives, of our person, of our spirit, that connect us beyond ourselves, that connect us to nature, that connect us to other people, that connect us to peak experiences. Whoa, what is happening? And in my perspective, this also includes altered states of consciousness. This includes when your loved one with dementia starts to time travel, and now it's the 1940s again, and they're 29. So for me, the transpersonal model just allows us to have a bigger, more comprehensive, and inclusive lens. So that means whatever you're bringing, let's honor that. Let's welcome that. Even if it sounds crazy, because I love the crazy stuff, because that's part of our human experience. That's real. So anything that's real, that's transpersonal. And everything that's maybe wooey, airy-fairy, that's also transpersonal. Your spiritual, your religious practices, that's also transpersonal. So the transpersonal banner is this all-inclusive psychology plus spirituality. Yeah, great question. So I'm no longer an expectant family caregiver. I am a family caregiver. My grandma, my uncle, Kathy heard while I was on the phone yesterday, my uncle just got out of surgery on Tuesday morning. And it's here, it's real. And when I go back home to Indiana, I jump right into the caregiver role. I'm there, I'm helping, I'm cooking, I'm cleaning, I'm doing what I need to do to support my loved ones, uncles, grandma. And I recently found out I have a new great uncle who has dementia. So that's number 6 in my family who have either passed or are struggling with Alzheimer's or another form of dementia. So that's why I'm doing this. That's why I'm here, because I am passionate about what we are doing. So let me introduce the 3 skills. Number 1 is the stop technique. Okay? We all know what a stop sign is, that red and white sign with 8 little signs on it, right? Stop. So we'll get to know the stop sign a little bit more. And like I said, we'll practice this concept of visual, verbal, touch. These are 3 layers of boundaries. Right now we're engaging visually, right? You see me, I see you. We're also engaging verbally. I see heads moving. I know you're taking me in, or maybe you're somewhere else. That's okay too. But we're not touching, right? But we are, in a way. We're breathing each other's air. We're interacting. There's distance and space. Whereas you two, you got a little elbow action next to each other, right? You're close. You feel it. So there's different layers and different boundaries we're going to explore. And then lastly, as I mentioned, tip of nose, hand under hand technique, I think, is absolutely essential. So, the stop technique. Very simple. We stop. That's step one. We stop. So once we've stopped, we just give ourselves permission to just pause and arrive here. So my invitation for you is just to stop. Stop what you're doing and just allow yourself to arrive here now. Just to be here for a few minutes. What does my seat feel like? What's going on in my body? How's my breath? Is my mind clear? Is it clouded? Am I having racing thoughts, or is it calm? Right? So just notice what's here, right? And if we can really pause for just a little bit longer, we can feel the rocking of the boat, right? This subtle movement back and forth. So once we've stopped and we've arrived, take a breath. So everyone, come on, join me. Take a breath. Okay, one more. Okay, the invitation is to take the biggest breath you've taken all day. Ready? I'm being dramatic here, but okay. Yeah. Now, what do you notice now? A little bit more oxygen in the body, a little bit slower. Maybe there's a little dizziness if you take a really big breath, right? That can happen. So in this part where we're also taking a break. We're saying, I've stopped, I've paused. Take a break here. We can be here now. And once we're here now, we can really begin to observe a little bit more. And I was just encouraging this, right? What's inside my system? What's going on? Am I in pain? Am I agitated? Am I angry? Am I confused? What's going on right now? And then beyond that, what's going on around here? What's in my environment? We're going to be going to a lot of unique places, and they're going to be full of external noises, new sights, new smells, people, voices, different languages that we might not understand. So if we take the time to observe the external, we can then notice how it's impacting us. Oh, that siren was too loud. Oh, there's all these people over here, and I'm a little anxious because I don't know what they're saying. And it just gives us a little permission to observe what's happening inside of us. And then the last part is to proceed. And the invitation is to proceed gently, with a little bit more calm, with a little bit more kindness, and with a little bit more purpose. We choose, right? This choice, because we chose to stop. And we arrived. We're here now. We chose to take a breath and take a break because we're here now. We chose to observe what's inside our system, and we're choosing to be here. We're choosing to come on a cruise. We're choosing to travel. We're here now. And so my invitation is, throughout this week, go slow. Go really slow. Slower than you think you need to. And be gentle. Be gentle with yourself. Be gentle with your loved one. Right? And then as you go throughout your week, go with a purpose. And maybe you don't have a sense of purpose of what that is yet. But my invitation is to discover, why am I here? Why am I here? Yeah, there's a practical, I'm trying to find some relaxation and relief, but maybe there's something bigger. Maybe there's a spiritual calling. Maybe there's I just feel a drive to be here. There's something there. So my invitation is to get curious about that and explore a little bit. What brought you here? With purpose. Okay. Visual, verbal, touch. So I want to take this moment for you to just take a visual inventory. What do you see up here? Just look at it. Look at the kind of dartboard shape I got going in here. Visual, verbal, touch, right? We start with this visual experience. I see you. I see you, right? I have to recognize that in this moment, visually, who's in the position of power? What did you say?
Myself, I am.
You're in a position of power. Excellent. Yes, I like you owning your power. In the context of me standing above you, though, who shows power, right? I do, right? Little things, right? We got to be really keen on what we're observing, and how fast I'm approaching you, right? Right? It can be intimidating if I approach you too quickly. Now, what happens if I get down like this, and I approach you this way, and now suddenly we're eye to eye level? And this is particularly important if someone is dependent on a wheelchair. If they are always at this level down here, us as the family members, us as the loved ones, us as the caregivers, we got to get down to their level. We got to meet them where they are. So once we've gotten to this visual engagement, I see you, you see me, we then can begin the next stage. Hello, how you doing? Right? Depends on your rapport, right? Obviously, you can just say, hey, you over there, after you've been married for 30 years. I hear that laughter, right? Sometimes that's true. Sometimes, hey, you is all you need. Sometimes it's, hello, Mr. Hodges, how are you today? Right? Just like our staff members here on this cruise, right? There's going to be all these people who, by the end of the week, they'll be calling you by name. Not only because you're wearing the name tag, but especially the people working on your hallway that see you over and over and over and over. They're going to be greeting you with kindness. They're going to be meeting you with this. Right? So beyond that, the way we're speaking. If I'm yelling at you, right? There's a communication there. If I'm whispering, really quiet, you can barely hear me, there's a communication there. This is really important because if your loved one struggles with aphasia, struggle trying to find words, sometimes they have word salads and it's confusing, then we can begin to listen to the cadence, the rhythm, the way they are sharing what they're sharing. Sometimes the way they express something is more important than the actual content of what they're saying. So we have greeted visually, I've communicated verbally. Now the next thing is touch, right? So if I come up and I suddenly just grab onto Neil's leg, he might kick me. A nice welcoming response to being startled and abruptly approached, right? While I can joke and jest about that, the reality is when we're working with a loved one who has some kind of impairment, we have to recognize that the way we approach them might be different. Okay, so before I go any further, I want to introduce something related to vision and the visual changes associated with dementia. So everyone get your hands out. Get your hands out. Okay, so what I'd like you to do is to take your hands and go like this, kind of make a C shape, or that's not a C. That's
Okay. We were talking about first grade things.
It's a D, a C, make kind of an oval shape. Okay, great. So as you're seeing now, you can see clearly, right? You can see me. So imagine your loved one that has a new diagnosis of Alzheimer's disease or something else. Go ahead and put your cup up, or your whatever the shape is, up to your eyes. Now, what do you notice? What's different here?
No peripheral.
You don't have any peripheral vision. So typically at the earlier stages of dementia and Alzheimer's, because of the degeneration of the brain, this is what the beginning stage of dementia starts to look like. So if I approach you from the side and you have no peripheral vision, startled because suddenly you're here in my face. Okay, so we got this grip here. Now, as the disease progresses, go ahead and cup it like you're making binoculars. Great, great, great. I see you with my binoculars out there. Okay, so what do you see now? What's different? What's different?
It's constricting the vision field.
Less. Exactly. There's less. Okay, now advanced dementia, advanced myopathy, advanced problems with your eyes. Okay, now close one of them, and I'll keep that little thing up there. Typically, at this point in the disease process, a person can only focus and interpret one image at a time. So they might be cycling from eye to eye, or maybe their vision is so impaired that this is only what they have. So this is the subtle things that we have to begin to pay attention to is, right, visual is going to change. And when the visual changes, that's going to change the way we interact verbally. And it's absolutely going to change the way we interact with touch. Because if we got this up here, and suddenly this person is right here talking to you, and then they turn, and then they're in your face, that can be jarring and unsettling. So, again, we're bringing intention, we're bringing awareness to how we're approaching. Okay, so what I mentioned is we're going to put this all together. We're going to put this all together because what we're trying to do with this model, with visual, verbal touches, we're trying to build healthy boundaries. We're trying to respect not just the person, but the culture. Some cultures, male-to-male touch is welcome. You see them kissing each other's cheeks. Other cultures, male and female interactions, they don't happen. You don't make contact. You don't touch. You don't connect. So there's different levels of culture we have to respect and acknowledge. We also have to recognize if someone has a history of trauma and aware that dementia is trauma. Caregiving is traumatic. The fact that there was a fall this morning, there's 1, 2, 3, 4, all 4 of us involved. One person fell, but all of us are impacted by the trauma of that experience. So we have to always filter. How does trauma influence the visual, verbal, and touch boundaries? Beyond that, sometimes we have a loved one who is having hallucinations, who's seeing things, who sees the little dog under your chair over there. I see that dog over there. And so instead of saying, no, there's no dog, there's nothing here, we want to accept, we want to acknowledge what's being said, we hear it, and we want to validate the experience. Oh, yeah, I see the dog under there. What's the dog saying? Can you tell me about it? And instead of judging and shutting down and saying, no, there's nothing there, we want to switch over to curiosity. What are you seeing? What are you seeing, loved one? What are you experiencing? What do you hear? Do you smell the dog? And then we can get to explore how many senses are involved. Do they want to pet the dog? And if they actually do this, do they feel the dog? Do they actually feel the dog? Because guess what, my friends? When a hallucination happens, it's actually happening in the brain. Okay? All my psychonauts who partied hard in the 70s with all the acid and LSD, guess what? Those hallucinations were actually happening in your brain. In that same context, that same lens of altered states of consciousness, we want to validate rather than reject your loved one's experience. And with all this, again, we're maintaining presence. We're choosing to be here now. We're choosing to connect with intention, slowly and gently. Okay, so let's move on to this last. Well, let me pause here. Are there any questions at this stage? What are your questions, comments? Has anyone experienced some of these boundary disruptions? Yeah. And what happens when you approach your loved one, or you yourself have been approached and your boundaries are disrupted or disturbed? Go ahead and shout it out.
You back up.
You back up. Whoa, right? Yeah. Great. What else? What happens?
Frightened, like you said, startled?
Yeah.
Yeah.
There's a fear response, a startle.
Response.
Absolutely. Excellent.
Lash down.
Yeah, right. Exactly. There can be a lashing out. Whoa, you get in my face. Boom. Right? I learned my lesson when I was taking care of an old boxer. Woo boy. Woo boy. I got kicked in the face. I got punched in the face. And I don't care what you tell me about a 90-year-old with dementia. They can punch a lot harder than I can. Woo. Okay. Anything else? All right. So let's flip that. What's it like to be approached when someone approaches you appropriately? When they see you, when they greet you, and they make contact? What's that like?
I'll smile.
Yeah, smile. Yeah.
And you welcome it. You know, you respond positively.
Yeah. There's a positive. I accept it, and I give it back.
I'm being respected.
I'm being respected, right?
They actually care what I think,
They care what.
instead
I
of just
think.
telling us what they think.
Yeah. It's being heard, it's being seen, and it's being felt. Absolutely. So let's practice this. Let's be seen, let's be heard, and let's connect. Okay, so the hand-in-hand technique is pretty simple. So you got two hands, right? One hand, one hand. So find a person next to you, find your partner. Yeah, exactly. Go ahead and see if you can't follow these steps, and then I'll guide you through it. See if you can figure it out on your own. What's happening here? Great, great. Okay. No, that's not it. That's okay. That's okay. That's looking good back there.
Act like you like each other.
Act like you like each other. I like that. Okay, that's more about it, right? There you go. That's it right there. That's it. If you want, would you raise your hand up so everyone can see this? Right? Okay, so this is close. I'm gonna go ahead and adjust your thumbs. Let me ask, is this okay if I adjust your thumbs?
Sure.
Okay. See, I gotta practice what I preach, right? Okay, so there you go. Great. So this is yep. So this hand and this hand. Actually,
Like this.
This is
You like it?
Here, and if you want to check, Kathy, would you check for you? So if you want to look up here, I'll show you how I crush. So we're visually, hey, Kathy, and I come in, and as Americans, what do? We go right in for the handshake. So once we get the handshake, we go right into this like butterfly, right? And then we squeeze. And once we squeeze and wrap around, we got a lot of information here. We can tell the warmth, we can tell the pressure, we can tell if this person's in pain. Because if she's squeezing my hand, ow, 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 that tells me a lot, right? There's a lot of information there.
It also tells fear, anxiety, stress.
Fear, anxiety, stress. Yes, absolutely. So as we're seeing right here, one of the next steps is how do we use this activity? How do we make use of this? So I guess we'll use the microphone. It's a little big, but it'll work. So if we're going to go in here, we put it between the thumbs, wrap around. Okay, so if you have an object, you can practice with that. If not, that's okay. But this is a way where if I wanted to brush Kathy's hair, we can brush her hair, and she is the one engaging it while I guide. So turn around this way. So same way, if this person no longer has the ability to brush their teeth on their own, we can brush their teeth and guide them with this engaging touch, right? It's a little weird, it's a little wonky, thank you.
No, it works.
It works wonders, particularly with people who have rhythmic memory left over, those who have music, those who have some dance, those people who are more inclined in that way, who have that part of their brain left over, because with the rhythm, we unlock some movement. And guess what? Brushing our hair is rhythmic. Brushing our teeth is rhythmic. So any kind of rhythm, any kind of ritual that we can engage, this is an extra way to find connection with your loved one, to build that connection. And also, when we're going to help with a lift, we're going to help with that, getting them here and getting that hand in hand and helping them up, that might be a great way to help a loved one up as well. I see you practicing it. Great, that's it, right? It's a little funky right now, but the more you get used to it, the easier it will become. And this is, again, particularly important as the disease progresses, as diseases progress. As we age, we have more and more limited mobility. Now, particularly those of you who have loved ones with a motor neuron disease or who have a movement disability where an individual has muscle rigidity and contraction, where they become tight and they can't move, where they freeze up, this is a great way to engage them and to bring mobility. Because again, you're getting immediate feedback in that hand. When you're moving them and you get to that part where if they can't speak, right, it's sore and painful, they'll squeeze you and let you know that this hurts them. Again, finding alternative ways to communicate and to receive the communication from others. So, is this making sense?
Yes.
Is this clear? Great. So now that you've tried it with your loved one, I want you to find someone else in the room and go try this with them. Okay? Let's see how this goes.
Yeah.
Jim, may I do?
I love it. Everyone's asking permission. This is it. This is what I love to hear. Hear a lot of chatter. Excellent, right? So, right, cold hands, we learned. There's a lot of information there.
That's right, you and Mr. Armstrong.
He's dead.
Okay, great. Beautiful. Okay, so we tried it with one person, we tried it with another. Was it a little easier the second time? What was different from the first person you connected with? Did you learn something new about them? I heard someone has cold hands over here. Cold hands and a warm heart, right? Yeah, exactly. So there's something else that just happened. A lot of conversations, a lot of smiles, right? We've just cross-pollinated.
Oh my God. I don't want to see the result.
I'm just saying, you're a blooming flower. Okay, so this is it. This is it. It's very simple. We have visual boundaries, we have verbal boundaries, and we have touch boundaries. And when we stop and take the time to take a breath, we observe what's going on in our system, we observe what's going on in this system around us, we can proceed with a little bit more gentleness and a little bit more kindness with ourselves and with our loved one. And that leads into a little bit more easier interaction with the hand-in-hand technique as well. So with that, I want to thank you for your time. I want to thank you for your interaction and your willingness to try out something new. And with that, I want to, yeah, absolutely, thank you. And I want to ask, is there any questions or do you have any comments about this?
That's interesting.
Yeah.
I mean,
What was interesting for you?
the different variations of everything that you can hold somebody and greet somebody and,
Yeah.
you know, make them feel good or.
Right. Yeah, right. How does touch do more than just make contact, right?
Yeah. It's a universal language.
Yeah, touch is a universal language. Absolutely.
Andrew, you mentioned Tifa Snow. I've been on her website many times. I'm on her email list. I have a few videos. Were you alluding to the possibility of her joining you on a future cruise?
That's my goal,
Oh, yeah, absolutely.
personally.
Yeah.
Oh, yes.
Oh, definitely.
Just because she knows what it is that we're doing
She's an OT.
so intimately.
Occupational therapist?
She is.
Yes.
And so she has the dementia expertise with the occupational therapy. And we, well, 3 of us have studied her technique, most of which I think are amazingly helpful.
Yes.
So being able to work professionally with her is some, you know, we are just post-COVID. We were shut down for almost 2 years. So we were prepared and on that track in 19. And then we have COVID.
So I'd like to sign up right now for one.
So, okay, the answer is that would be what we're seeking. Absolutely.
One thing that I really respect about Tifa Snow is she was a CNA. She started out 18, 19 being a CNA. So she has had hands-on experience with difficulty in the early 80s with working with people with dementia when you had no education base. And then you apply that occupational therapy degree with that in practice. It just is a nice polished product.
Yeah, and that's the same thing with Tifa Snow doing occupational therapy. I took a similar route going through CNA work, and now I'm a clinical mental health counselor. So while she might focus on the physical movements of the individual, I'm really interested in the emotional movements of the individual, right? How are you impacted by this?
And the truth is, Barb and I went to college at the same time that Tifa Snow did. And in the 80s, none of this conversation was even part of education. You know, literally, you know, we have, you know, BSN degrees, and it was never mentioned. And so the pieces of being willing to learn going forward is, I really respect the opportunities to keep learning, to keep knowing, and to keep helping. Because we can't help